Hello, welcome to Skin World with Vincent. Do you know that acne is one of the most common chronic skin lesions among adolescents? Stay tuned, don't go anywhere as I take you through a discussion about acne. Acne is one of the most common but chronic or recurring skin diseases, mostly presenting with non-inflammatory or inflammatory skin lesions. Acne is mostly common in adolescents and young adults, although it can occur among people of all ages, which is it can occur from infancy to adulthood. So some cases can present with acne and you may be surprised. Acne mostly resolves in the middle 30s or early 40s, but has the tendency of reoccurring, which is mostly referred to as de novo. Let's look at the pathology of acne or how acne occurs. The first most important factor is excess sebum production or excess oil production by the sebaceous gland of the skin. Second, which is infection by the Propionibacterium acne, a gram-positive bacteria popularly known as the Cutibacterium acne. Then the third, which is inflammation. And fourth, or the last point, which is proliferation or follicular proliferation. Now, formation of acne begins with microcomedones. And when we say comedones, basically they are the small rashes we mostly found on our skin or the bodies. Before comedones occur, the pores of the skin are mostly blocked with dead skin cells and oil. That is the oil being produced by the sebaceous gland, or basically they are being blocked by the sebum, dead cells, and dead. These dead cells, sebum, and the dead are being infected by this Propionibacterium acne, which mostly leads to inflammation of the skin. And whenever inflammation starts, the follicles starts to proliferate, leading to the formation of what we mostly see on the faces as pimples. Now, the clinical presentation of pimples, or before we identify that someone has pimples, being it in our local settings or within the clinical settings, mostly we see comedones, and comedones mostly occurs on the face, the back, the chest, and sometimes the anus. This comedones occurs in places of high sebaceous glands. Now, comedones, which is the non-inflammatory lesions, may be white or dark comedones. The white comedones, also known as the closed comedones, are the lesions that we see on the face or the chest or the back that is not broken and mostly look white, as seen in the picture above here. With the open comedones, they are mostly black in appearance, and this is as a result of the break and the contents in the sebaceous glands or in the pores of the skin being oxidized by air and that of the melanin, leading to the black presentation of the acne or the black presentation of the comedone. Now let's look at the inflammatory comedones. The inflammatory comedones occurs when there is rupture of the follicles, or when there is follicular rupture, or when the immunity of the body responds to the bacteria causing the acne, which is the Propionibacterium acne. It leads to inflammation, and these inflammations comes in different forms, being it a pupil, a papilla, noodle, or a cyst. Now, When it presents with purples, it may be tender. And when we say purples, they are the small pimples that we mostly see on the face. And because it's tender, it means that it is painful. That is what the one can and as a one you can feel some pain. We also have pustules, and as the name goes, pustules meaning it contains pus. So the fluids in these comedones can be white, or they may have some yellowish tips. We also have nodules, which is the larger form of the pustules. So here the collections are deep within the skin. And the last of which, or which is the cyst. These are the bigger lesions that we see on the faces. And mostly these are the larger forms of the nodules that we see in some of these lesions. Now let's look at some of the factors that leads to acne, or some of the causes of acne. First is family. So sometimes some people are prone to this acne or pimples because it is mostly common in their family. The second factor, which is hormonal base. So mostly when it comes to women, they mostly have pimples when they are about menstruating or during their menstrual periods. Another thing is increased androgen, which is a male hormone, but mostly when it increases, it leads to excess production of sebum or excess production of oil. As I said first, oil or the sebum is the major or one of the factors needed in the formation of acne, or needed in the formation of the comedones, that is the lesions we see on the face. We also have skin irritants, and the irritants can be the soaps, the detergents, the washing powders, sometimes the creams that we apply on our bodies, the oils that we apply on our bodies, some moisturizers, as we talk about in one of our videos, mostly leads to the formation of acne. Because example is that you using an oil-based cream, or you using an oil on your body, and if you are a person, or if you are someone with the oil skin type, mostly the body is producing excess oil, and if you apply a lot of oil, this oil can block the pores of your skin and may lead to the formation of comedones, or the pimples that we mostly see on our face. So we also have stress, which is one of the major factors that worsens acne. We also have diet, and with diet, mostly there is no significant evidence backing this diet as a major cause or as it worsens acne. And this will be a whole topic that we will discuss in one of our upcoming videos. We will talk about diets and skin infections, or diets and acne. And mostly some writers believe that diets such as high sugar diets or high sugar containing foods such as chocolates, dairy products such as milk powders, eggs, and even nuts, and it can be granules or any form of nuts, can also lead to the formation of acne or can worsen your acne. Some drugs can also cause acne. A drug like phenytoin, isoniazid, lithium, glucocorticoids, and some other drugs. So a glucocorticoid like that of the dexamethasone can mostly cause acne, and excess use of topical steroids on your body can also lead to acne. Another drug that can also cause or worsen pimples is isotretinoin, which is a medication used in treating acne. But if it is not being used well, it can also cause acne because it causes dryness of the face and mostly can worsen your acne. Now let's look at the severity of acne, and we mostly groups them into mild, moderate, and severe. So with mild acne, it's mostly present with less than 3 comedones or less than 3 pimples on our faces. Then the moderate have about 4 to 20. Then the severe ones, which is 20 or more. With the severe form of acne, mostly it presents with more than 20 comedones or more than 20 pimples that we see on our face. And mostly they have nodocystic lesions or widespread scars. Now, let's look at the types of acne. So we have the acne vulgaris, which is the most common form of acne that we mostly see in our settings. They mostly present with the whitish comedones or the white comedones or the open comedones. Now the next type, which is the acne fulminans, mostly presents with acute eruption of large inflammatory needles, and it mostly occurs in people with pre-existing acne, and it is very common among males. Now let's look at acne conglobata. Now acne conglobata is a severe form of acne which is similar to that of the acne fulminans, but here there is systematic symptoms such as malaise, general body weakness. Sometimes there may be headache associated with the pains that you may be feeling on your face, and here there may be large scars associated with this form of acne. Now let's look at some of the treatments we use in treating acne, or let's look at some of the measurements. First is the use of cleansers or water-based cleansers. So you're supposed to use a cleanser to clean your face in the morning and in the evening before you apply any topical cream. And some of the topical creams are the retinoids, the benzoyl peroxides. You can also use adapalene gel or adapalene plus clindamycin. Sometimes add oral treatments to the management depending on the severity of your acne. So if you have pain, you can use an analgesia, and if it is itchy, you can use histamines such as the desolatidine, the levocetirizines, and the cetirizines or the risins that we do. You can also add antibiotics such as the tetracyclines. Example is the doxycycline. Antibiotics such as erythromycin and clindamycin can also be used when you have the severe forms of acne. This is going to be the part 1 of our acne discussion. We are going to talk about the proper management of acne in our part 2 of the discussion. We are going to talk about how to use some of these topical medications, when to apply them, when to start an oral medication, and when to stop with the treatment. This is Skin World with Vincent. Follow us, share, subscribe, and turn on the notification bell